I was very angry when I read the Wired magazine article about the advances in breast cancer reconstruction, because the author used the term mutilated for describing mastectomy surgery.
For those of you playing along at home, I will offer a little show and tell. This is the cover of Wired magazine that has the story that Alicia refers to in it.
I do a lot of searching on before and after pictures on breast reconstruction because I did have it, and I want to know what's going on in that field. And I'm very shocked at the condition of some women in the before pictures, that it isn't just a simple straight line surgical scar, that some of them look mutilated, quite honestly.
To read the words mutilated in terms of talking about a mastectomy, I guess really hit me hard, because essentially that's what happened to me. I had a double mastectomy. Fortunately, I had a surgeon that drew a very straight line across my chest, which I'm thankful for. And I feel pretty fortunate that I came out of that surgery the way that I did in terms of look and feel.
I have boobs. They're here. They're a little low now. I'm older. But I own them. I'm happy I have them. I'm happy I got to keep most of one and all of the other after dealing with cancer. I can also understand why someone might, as Alicia did, end up electing to have a double mastectomy if they have breast cancer diagnosis at a very early stage and there's a genetic component. As far as I'm concerned, you're out of here.
I prefer to refer to my surgery as my 100% breast reduction. So perhaps that's why I take a little offense to terms like that.
It never occurred to me until I listened to you, Alicia, that if I had your scars and your body, and I heard people describing that as a mutilation, it would feel very different. I don't feel mutilated, but I can certainly understand why that was offensive to you. And now I join you in your feeling offended.
The fact that the author of the piece and the article inside the magazine tended to look at a mastectomy as a mutilation, that I think is a little severe, especially since mastectomies now are not mutilating.
I suspect that the Wired magazine article may represent the common attitude that if you have a mastectomy, you are mangled, you are mutilated, period.
I'm amazed that we have not made more progress in the way we've dealt with cancer and the way that we've talked about cancer.